This video only covers selected highlights of the Remunity Pump user guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the Remunity Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will cover steps to follow when changing out your used cassette for a new one. In this chapter, we will cover how to stop delivery and how to disconnect your infusion set. To prepare, wash your hands with soap and water, then gather your supplies. For this step, you will need a fully charged remote, your pump, a disposable cassette kit, and an infusion set. Now, we will cover how to stop medication delivery from your old cassette before changing it out with your new one. Please note that certain electronics may affect communication between the pump and remote. If your pump and remote are unable to pair together or remain paired, move at least 3 feet away from cell phones, Bluetooth devices, equipment that sends or receives radio waves, and Wi-Fi equipment, and repair your programmer and pump. To begin, press the side button to wake up your remote. Go to your pump's main menu by pressing each front button left to right to unlock your screen. Then, select Change Cassette and press the checkmark. Once you have selected Change Cassette, press the checkmark to stop medication delivery. Next, an alarm will display on your remote screen. Press the X'd out bell to silence the alarm. Press the checkmark to acknowledge that delivery has stopped. Do not remove the pump from the used cassette until after you have removed the infusion set from your body. Disconnecting the pump before you remove the infusion set from your body could lead to unintended delivery. After you have stopped delivery and cleared the alarm from your remote, disconnect the infusion set from your catheter. And while holding the cassette still, rotate the pump counterclockwise until the pump's pump bump is aligned with the unlock symbol. You should hear a 1-beep tone from the pump. After you hear the 1-beep tone from the pump, separate the pump from the cassette. Avoid unnecessary contact with the pump's battery bay portions exposed during the cassette changing process. Also, keep dirt, lubricants, and liquids away from the battery bay portions of the pump exposed during the cassette changing process. Dispose of the used cassette in the household trash. Refer to your infusion set's instructions for proper disposal of infusion set tubing. At this point, follow your infusion set's instructions if you're changing your catheter and/or infusion site. Before priming and attaching a new cassette to your pump, you should first replace the pump battery with one that's been fully charged. Directions for charging your remote and pump batteries can be found in Video 1, First Time Setup. First, turn the pump over and use the end of your finger to remove the pump battery. Avoid unnecessary contact with the battery bay. Next, you'll retrieve a fully charged battery. Before removing the remote from the charging outlet at the beginning of the day, check for a green light that indicates the battery in the bay is fully charged. Open the clear cover and remove the fully charged battery from the bay on the back of the remote. You can also take a fully charged battery from the battery charger. Insert the depleted battery into the back of the remote's battery bay. Make sure to charge the remote with the inserted battery at the end of the day. And remember, you can also insert the depleted pump battery into the battery charger. Next, insert the fully charged battery into the pump. The pump will sound 1 beep to let you know it's ready. And remember, you should obtain new batteries from your specialty pharmacy every 3 months for your pump and every 12 months for your remote. Next, in this chapter, you will prime a cassette. Priming a cassette means getting it ready to deliver medicine to your pump. To prime a cassette, you'll need a cassette kit and an infusion set. First, take the priming aid with the pharmacy-filled cassette from your cassette kit and place the black side on a flat, non-slippery surface, like a tabletop. Next, press down on the priming aid until you hear a click. And then, once you have heard a click, locate the end of the tubing and remove the cap from the connector as shown here. Once the connector cap has been removed, set your priming aid aside, and then retrieve and open your infusion package. Remove the tubing from the package. Connect the infusion set and cassette by twisting the lock connectors together. Do not insert the new infusion set catheter into your body until after you have prepared the new cassette and connected it to the pump. Inserting the infusion set catheter before connecting the cassette to the pump may lead to unintended delivery. After you have connected the infusion set and cassette tubing, hold the cassette and rotate the priming aid clockwise until the arrow aligns with the drop symbol found on the white tab at its base. The infusion set and cassette are primed when you see drops at the end of the infusion set. Make sure to wipe any medication residue with an absorbent towel or cloth, and use soap and water to wash any areas that came in contact with Remodulin. When you see drops at the end of the infusion set, rotate the priming aid counterclockwise until the tab becomes aligned with the unlock symbol on the cassette. Next, detach the priming aid from the cassette. Wipe any medication from the cassette's top with an absorbent cloth or towel, and then dispose of the priming aid in your household trash. Make sure you do not dispose of the newly filled cassette. Your cassette has successfully been primed. At this point, wipe any medication residue and using soap and water, wash any surfaces that came in contact with Remodulin. In this chapter, you're going to connect your primed cassette to your pump and start delivery of Remodulin. You'll need your infusion set, primed cassette, remote, and pump. Before connecting the pump to the filled cassette, do not connect the infusion set tubing to your catheter. Also, inspect the cassette and infusion set tubing for leaks. If you see any leaks, replace the cassette and the infusion set tubing. Wipe up any medication residue with an absorbent towel or cloth and wash contacted areas with soap and water. Also, check to ensure the interfaces of the pump and cassette are free of dust, lint, and debris. After you have checked to make sure there are no leaks, it's time to connect your primed cassette to your pump. Connect the primed cassette to your pump by first aligning the pump's pump bump with the unlock symbol on the cassette. While holding the pump and cassette together, push and rotate the pump clockwise to align with the lock symbol. The pump bump should align with the infusion set tubing. You should hear a series of beeps coming from the pump, followed by one last confirmation beep. Your pump will perform a self-test. Do not connect the infusion set tubing to an inserted catheter before the pump completes the self-tests. Doing so may cause an over-delivery of medication, resulting in harm. Once the pump's self-test is complete, connect the infusion set tubing from the pump to your inserted catheter. Consult with your specialty pharmacy about how often to change your catheter. To start medication delivery, press and hold the blue pump button. You can also press the check mark on your remote. The pump will make a 3-tone sound and delivery will start. Your remote will display a green bar to indicate that the pump is delivering. Check to make sure the displayed rate matches your prescribed rate. In this chapter, you'll learn the steps you should follow if you choose or need to stop and start delivery without your remote. If you choose or have to stop and start delivery without your remote during a cassette change, your first step is to disconnect the infusion set tubing from your catheter. Do not remove the pump from the used cassette until after you have removed the infusion set from your body. This prevents unintended medication delivery. Follow the steps in chapters 2 through 5. Then, when you're ready to start delivery, press and hold the blue pump button. The pump will make a 3-tone sound and delivery will start. Remunity Pump for Remodulin Treprostinil Injection. Indication: the Remunity Pump for Remodulin Treprostinil Injection is intended for continuous subcutaneous delivery of Remodulin Treprostinil Injection for use in adults greater than 22 years of age. Important safety information for Remunity. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only Remunity cassettes may be used with the Remunity Pump. Remunity Pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7230-24, 21-7220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. Discontinue use of the remote and switch to the spare remote in the event the remote fails to operate. The use of cables, batteries, and battery chargers other than those provided or specified may result in increased emission or decreased immunity of the Remunity Pump infusion system. Do not disconnect the pump from the cassette while the cassette is connected to the catheter. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire or rapid spreading of fire resulting in harm. This system supports flow rates between 16 microliters per hour and 225 microliters per hour. If your flow rate is outside this range, discuss with your healthcare practitioner. Prescription information. Caution: Federal law, USA, restricts this device to sale by or on the order of a licensed healthcare practitioner. Use of this device without the training and supervision of a healthcare practitioner may lead to errors that result in harm. See the Remunity Pump for Remodulin Treprostinil Injection Pharmacy-Filled User Guide for further detailed important safety information including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corps at 1-877-864-8437. The Remunity Pump for Remodulin Treprostinil Injection is manufactured for United Therapeutics Corps. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin Treprostinil Injection. Indication or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.